morning.
Chaplain Dick Maddox's passion is helping children, teenagers, and young adults who have cancer at the MD Anderson Children's Cancer Hospital.
Nothing's going to bite me now, right?
No.
Okay. Do you live in a barn?
No.
Or do you live in a treehouse? I love your dress.
Thank
it's so
you.
pretty. You're such a good artist, too. Do you feel bad after you get chemo here once a month?
No, actually I don't. I get like real hungry after chemo.
Well, that's a good side effect.
Yeah, that's a good side effect.
So if you come here and you are patient, will you teach me some Spanish? Would you? Yeah, for all of my career in ministry, I've always seemed to have that ability to communicate with children at whatever age they are, and I've always had that ability to enter their world. It's what I call building trust, beginning to build a relationship with that child particularly, and with the family, such that as time goes by and the challenges of treatment and therapy and living through all this with cancer becomes greater for them. The doctors and mid-level practitioners and others always want the chaplain to be involved in the team meetings so that we can keep up with the therapies of the patients. And so I monitor that, and as children get greater challenges in their therapy and their care, then I begin to get closer to their situation. Gracious God, we are so grateful for this very moment, this very sacred moment when we humble ourselves before you with these cells.
As Felipe prepares for a stem cell transplant, his family, healthcare team, and chaplain say a prayer of hope.
May they go straight forward into his marrow, Lord, and begin to produce wholesome, healthy cells so that he might recover very quickly. But most of all, Lord, we pray that you would gather close. Our role is to go and to provide as much comfort and to provide a spiritual presence consistent with and respectful of the faith tradition, if any, of that patient and family. Here at the Children's Cancer Hospital, we're very blessed to have many families come from the Middle East and from places where their faith is Islam. We run into people from the Hindu tradition, the Buddhist tradition, from all sorts of religious traditions that might not be as familiar to people in this part of the world, but it's a real blessing, and we want to encourage and support them to better understand what they need in order to cope with what they're going through and to reconnect with whatever higher power or supreme being is in their life.
In spring of 2003, Sip and Rhonda's daughter Katy was diagnosed with rhabdomyosarcoma, an aggressive form of connective tissue cancer.
It was devastating. My husband and I both met with Mr. Maddox, and he was wonderful with us. I'll never forget a lot of the different things that he did for us. Just being supportive and just, you know, someone to talk to. When Katy passed away, he was there with us that whole day, just helped in so many ways.
Soon after the death of a child, the mother is given a token of remembrance.
It's called a remembering heart, and it has two parts. There's a small inner heart, which we remove. The smaller heart, we tie it to the child's wrist, and we make sure we let everybody know that this is to remain with the child forever. And we take the outer heart and we give it to the mother of the patient. We do have semi-annual memorial services for all the children that battle cancer and unfortunately are not successful in living through their journey with cancer.
Rhonda and Sip now volunteer on the Supportive Care Committee for Children's Cancer Hospital, along with the chaplain and other staff.
Dick Maddox is, I call him the anchor, because he can just bring so much to the table from the families because he works with them every single day. You know, he's right in there in the trenches. We couldn't do it without him. There's no way.
Together, the committee authored a book that helps parents cope with their child's cancer journey.
I'm blessed many times to be with children and teenagers and young adults whose therapy goes very well. Recently, I got the opportunity actually to preside at the wedding of one of my stem cell transplant patients, and it was covered by Bride magazine, so I was very excited about that. I think the key element that I would want people to appreciate about the Children's Cancer Hospital providing pediatric chaplaincy is that it's the action of providing a person that can be on the journey with them. Even the children, youngest children who are going through cancer therapy are often confused. And so here's this person who comes to be with them, who is willing to listen and to encourage and to offer to pray with them and to bring the hope that comes through spirituality. For me, that's a tremendous contribution by the Children's Cancer Hospital and a tremendous commitment that many other hospitals don't step up to. My message is one of gratitude to the Children's Cancer Hospital to provide spiritual care for their children as they go through this very difficult time. There's that smile. I knew I'd get a little smile out of you.